This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Dydrojoy 10 tablet is a hormonal therapy used to treat progesterone deficiency states. It helps alleviate menstrual pain and other discomforts. Indications and uses. This medication is indicated for relieving menstrual pain, managing symptoms of endometriosis and premenstrual syndrome, and supporting female reproductive health. It is also utilized in postmenopausal women to manage menopausal symptoms when combined with estrogen therapy. How it works. Dydrojoy 10 tablet works by restoring adequate levels of progesterone in the body, which helps improve uterine lining thickness and alleviates symptoms associated with hormonal deficiencies. Directions for use. Take this medication as prescribed by your physician. It should be swallowed whole with a glass of water and not crushed or chewed. It can be consumed with or without food. Consistency and timing is important, so try to take it at the same time each day. Your doctor will determine the appropriate dosage based on your age, body weight, and specific health conditions. Possible side effects. Common side effects may include severe headaches, nausea, breast pain or tenderness, and irregular menstrual periods. It's important to consult a healthcare provider if these symptoms worsen. Precautions and warnings. Exercise caution when using this medication, especially if you have liver or kidney problems. It is not recommended for individuals with certain health conditions like blood clots in the lungs or heart disease. Always inform your healthcare provider about any existing health issues before starting treatment. FAQs. 1. What is Dydrojoy 10 tablet used for? It is used to manage progesterone deficiency states. 2. How should I take it? It should be taken as directed by your physician, swallowed with water. 3. What are the side effects? Common effects include headaches and nausea. 4. Can I stop taking it suddenly? No, do not stop without consulting your doctor. 5. Is it safe for children? Only postpubertal girls should use it under medical advice. Thank you for watching. If you have any questions or suggestions, please leave a comment below. We appreciate your engagement.